Dr. Swati Kaptikar from MFine. There are many diseases surrounded by myths. Today, let us talk about HIV and AIDS. HIV and AIDS is a global health public issue. WHO has stated that in 2020 there were 37 million people living with HIV and AIDS. Let's discuss some interesting myths and facts about HIV today. Let's start. This is a myth. HIV is a sexually transmitted disease. It is transmitted through unprotected intercourse with an HIV positive patient or transfusion of infected blood and from an infected mother to child. HIV is not transmitted by social contact like touching or sharing of spoons or sharing of clothes. There is a theoretical risk of transmission of HIV through saliva, but a small peck on the cheek will not lead to an HIV infection. This is a fact. HIV infection does not always lead to AIDS. If someone is detected with HIV, it does not mean that it is going to progress to AIDS. HIV affects the immune system of the body, and AIDS, which stands for Acquired Immunodeficiency Syndrome, is the last stage of HIV. In this, the HIV infection has affected the immune system to such an extent that other infections can thrive. These are called as opportunistic infections. AIDS is a clinical diagnosis made by the doctor based on CD4 counts and the opportunistic infections. Hence, it is very important to get oneself tested and start the treatment early so that we can prevent HIV to progress to AIDS. This is a myth. A person who has been infected with HIV may not show symptoms for years. A patient may be harboring the HIV infection but may remain asymptomatic. Just by looking at a person, we cannot say whether the patient has an HIV infection or not. Hence, if there is a suspicion, it is very important to get oneself tested early so that it can be treated and controlled. This is a myth. HIV positive patients can have children. HIV virus per se does not affect the reproductive capability of a person. However, if people living with HIV want to have children, they should involve the doctor in their decision. If a mother is HIV positive and on regular treatment and has undetectable viral load, then the chances of transmitting the HIV infection to the baby is very low. The baby will be given medication for a few weeks after birth to prevent infection. However, if the mother is infected and not on treatment, then the risk of transmission of HIV to the baby is very high. This is a fact. Mosquitoes are known to transmit viral infections like dengue and yellow fever. However, studies have shown that mosquitoes do not transmit HIV infection. This is because HIV virus cannot replicate inside a mosquito, and the lifespan of the HIV virus inside the mosquito is not long enough for it to reach the salivary glands and to be transmitted by a mosquito bite to human beings. This is a myth. AIDS is not always a death sentence. In the current age, with the effective antiretroviral therapy, we are able to suppress the virus replication. With the present effective diagnosis, prevention, treatment and care, people living with HIV can live long and healthy lives compared to previous times. This is a myth. If both the partners are infected with HIV, it is still wise for them to use protection. They may be affected with different strains, and hence a possibility of co-infection or reinfection is always there. A co-infection with a different strain can always deteriorate an otherwise stable infection. However, if both the partners are on treatment and have undetectable viral loads, there is always a possibility of transmission of other STDs or unwanted pregnancy. Hence, it is always advised to use protection with a barrier contraception. I hope this video helps you understand in detail about the myths and facts about HIV and AIDS. If you have any suspicion that you may be having an HIV infection, please get yourself tested as soon as possible because an early intervention will help manage the disease better.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.